My name is Ed Curtis. I'm President and CEO of Memorial Health System, and I'm joined today by Dr. Raj Govindaya, the Chief Medical Officer of Memorial Health System. We're standing here in the Memorial Health System Incident Command Center, where we're dealing with the outbreak of COVID-19 in our community, our state, and throughout our country and world. I'm going to ask Dr. Govindaya if he would update us a little bit on what is COVID-19 and why are we so concerned about this particular virus at this time?
Thank you, Ed. Coronavirus, or COVID-19, is a new virus that has never been spread across the world. The World Health Organization is calling this a global pandemic. What does that mean? That means we have something that is new, that we've never seen before, spreading around the world. We tried to contain it. That didn't work. We're now trying to slow it down. All of the things you've heard are actions to slow it down. Last week, we did a video, and it's on our webpage, where you can learn more about this. Because of this global pandemic, our health system is preparing for a surge of patients. But we're asking for your help through social distancing to slow down when people get sick so we are prepared. We've taken a lot of steps to do that, and I'd like to talk to you a little bit about where we are today. So across our health system, in the communities we serve, there have been 4 positive tests. Those have all been in Sangamon County. Now, we've also had several negative tests, over 50, and we're waiting on the results of more. The 4 positive people all traveled from somewhere else. They were not here in this community. The negative tests are from people who mostly are local in our community. What does that tell us? That tells us that the disease is somewhere else. It could come here, but at this point, it does not look like it's spreading rapidly in our community. So we have a little bit of time to prepare properly. To prepare, we're going to have to practice some social distancing. And these decisions are difficult. We are going to limit visitors at all 5 of our hospitals. This will be effective Saturday, March 21st. There will be limited exceptions at end of life and for the birth of a child. If you come to a Memorial Health System facility, you will be expected to be screened to make sure that you do not have symptoms that could injure our patients or put our healthcare workers at risk. What are those symptoms? That is a temperature over 100.0 or respiratory symptoms such as cough, shortness of breath, or sore throat. We ask that everyone self-monitor themselves for these symptoms. If you have them, you really shouldn't be around other people. This is just common sense, and in the era of social distancing, to flatten the curve, we need everyone to be doing this. We're also asking everyone who comes into a Memorial Hospital because they work for us or they help provide care here to also do the self-monitoring. I hope you are doing this now in your own homes. And these measures are essential for us to slow down the spread of the virus, to accomplish social distancing, and to flatten the curve. Ed, I'll turn it back to you.
Thank you, Dr. Govindaya. I think one of the other encouraging things we've seen over the past couple of weeks is we have a very large, diverse medical community. And all healthcare organizations have come together with common set of rules and guidelines for fighting this virus. So hospital, HSHS, and all their Illinois hospitals, all the Memorial Health System hospitals, the Springfield Clinic, SIU School of Medicine, and our county health departments are working together. So when Dr. Govindaya mentioned visitor restrictions at our 5 hospitals, that includes the 9 Illinois HSHS hospitals as well. So the efforts of working together, I think, are very, very important as we go forward with this virus. Now, this afternoon, Governor Pritzker in the state of Illinois issued a guidance for stay at home. Why is he doing that? We want to continue to, as Dr. Govindaya said, to prevent spread. These are very serious requests for guidelines to be followed. It doesn't mean that for healthcare workers, they can't come to work. It doesn't mean that you can't go to the grocery store. It doesn't mean that you can't go to your pharmacy or get gas. But to the extent that's humanly possible, please practice social distancing. Now, you heard Dr. Govindaya say, patients in our hospitals throughout Central Illinois, we have to restrict visitors starting tomorrow. As we do that, these are very difficult but necessary decisions. Our patient experience teams throughout HSHS and Memorial will provide opportunities for you to chat with your loved one. Certainly in life-threatening situation or the care of a child that's acutely ill, we'll make accommodation. But we're doing this to do our part to flatten that curve. Now, when you're out in the community, follow the recommendations for using personal protective equipment. Don't use it, practice social distancing. Stay away from people. Going to the grocery store with plastic bags and all this personal protective equipment on is not necessary, but as Raj and I are doing here, we're 6 feet apart. That is very, very important. Now, he said, self-monitor. If your temperature is 100 degrees or higher, or you're having the symptoms that he mentioned, respiratory, do I have a cough? Do I have shortness of breath? Do I have those type of illnesses? You want to make absolutely sure that you're checking with your physician, your healthcare provider, and you continue to socially isolate yourself going forward. Now, we're here for you. So we've stayed at work so you can stay at home for us. That is very, very important as we go forward. And we thank you for the opportunity to update you today on what's going on with the coronavirus and COVID-19 in our community. And Raj, any closing comments, or do you think we've covered this today?
This is not easy, but if we do these measures, we'll get through this together. And we look for your support, and thank you for everything you're doing as a community for us.
Thank you. Thank you for listening, and thank you for adhering to the social distancing, and stay at home when at all possible. Thank you.